Three birth and neonates and the neonate. A neonate is a baby for the first couple weeks of its life. I used to work in the neonatal intensive care unit at hospitals, at Children's Hospital in Omaha, and then again at Mercy Hospital in Edmond, Oklahoma. So let's go ahead and get started. Might as well get started. There we go. The first stage of delivery is the longest and typically lasts 12 hours or more. Let me make sure this is the right chapter. Yeah, I guess it is. In first children, the first stage is longer and becomes exceedingly shorter the more children a woman has. This stage involves contraction of the uterus, causing the tiny hole in the cervix to expand. I think we talked about this last time. Yeah, we talked about this last time. And there you go. The country with the largest number of cesarean sections, strangely enough, is Brazil. As weird as that is. Historical and cultural variations, peculiar history of birth in the West. Pre-15th century, midwives were respected. 15th century, midwives were suspected of being witches because they were able to keep women alive. 18th century, medical schools and physicians began doing deliveries. Field of obstetrics was born in the 18th century. That's the 1700s. 20th century, doctors not properly trained to handle childbirth. It led to misuse of drugs for delivery, including morphine. The late 20th century backlash led to advocating natural childbirth. With hospital deliveries, no difference in maternal health or neonatal outcomes between natural childbirth and medical methods. And that's one of the things we discovered by looking at the statistics. Celebration of birth. The Illa of Zimbabwe praise the women and offer her gifts. And there are some of the gifts that they might offer her. Fear of wariness of birth. The Arapesh of New Guinea only allow birth on the outskirts of the village in a place reserved for menstruation activities to prevent village contamination. We wouldn't want the village to be contaminated. Cultures may have purifying traditions for mothers after she gives birth. The placenta also has a meaning. Some cultures bury the placenta in a sacred place. Some cultures believe it has value for hormones and nutrients. Attempts to ease birth process include abdominal massage and herbal teas, herbal medicines to cope with pain. The midwives give instructions and encouragement, symbolic symbols placed in different areas of the room. Emotional and social support is important. Medical use of epidural seen in developed countries. The birthing position also eases pain. In Europe, they use an upright, semi-sitting, half-reclining position. The placenta is delivered through various methods. The umbilical cord may be cut and tied. And these are the birthing chairs from Europe. This is one from the 17th century, and this is one from today. They sit up to give birth. And of course, we know that mortality rates are so much higher in Africa, especially sub-Saharan Africa. This is India, and that's Afghanistan, I think. Yeah, this is Pakistan. That's Afghanistan. Yeah. Complications of childbirth. Birth trauma may be caused by anoxia or oxygen deprivation. Could be caused by diseases, infections, or physical injury. Low birth weight babies fall into two categories, preterm and small for date. Seems like I've said this before. A low birth weight baby, if necessary, is placed in an incubator. Oops. 50 years ago, the leading cause of intellectual disability in the United States was a condition in some neonates that did not allow them to metabolize protein properly. It produced a waste product known as phenylketonuria, which built in the blood, and it would destroy brain cells because it was toxic. Now, by screening all babies at birth, phenylketonuria can be placed in a special diet and live otherwise normal lives. I think I said this last week. Hypothyroidism and galactosemia. I told you the story of the pancakes in the in the nursery. Galactosemia smells just like maple syrup. I swear it does. And we looked at these last time, and we looked at those last time. Low birth weight is less than 2,500 grams, about 5.5 pounds. Very low birth weight is less than 1,500 grams, or 3.3 pounds. Extremely low birth weight, less than 1,000 grams, or 2.2 pounds. Causes for low birth weight in developing countries: malnourished mothers and lack of prenatal care. In developing countries, cigarette smoking is one of the causes. Overall, multiple births, maternal age, and drug use can cause low birth weight. Consequences of low birth weight: high mortality rate, of course, low birth rate for small to date infants, for maternal malnutrition, illness, and exposure, low birth rate for preterm neonates, inadequately developed physical systems, immature lungs, immune system, and central nervous system. And that's what an incubator looks like from the outside looking in. We used to save most of the babies. Most of the babies that we lost were due to severe abnormalities. Sadly, a lot of those abnormalities were caused by drugs, especially cocaine. Real serious problem. Rates of low birth weight around the world. And as you can see, India and sub-Saharan Africa are the biggest problems around the world. Treatment for low birth weight infants include kangaroo care, skin-to-skin contact for 2 to 3 hours a day, infant massage. Even with assistance, low birth weight babies are at risk developmentally. The average baby born in the United States is 20 inches long and weighs 7.5 pounds. 95% of all full-term babies weigh between 5.5 and 10 pounds. They are between 18 and 22 inches long. Firstborns tend to be lighter than laterborns. Boys tend to be slightly heavier and longer than girls. The first few days of the neonate will lose about 10% of its body weight, because most of that body weight is fluid that the baby has accumulated, so that the birthing process wouldn't damage the organs and the bones and whatnot. Most of the weight is fluid. Oh, I've already said that. The baby will begin gaining weight back by the 5th day and are back to their birth weight by the 10th to 14th day. My mother said, my youngest brother was weighed about 13 pounds when he was born. My mother was only 4'8". She was a tiny little thing, and he weighed about 13 pounds. One of the problems was that he was late. He was like, he had a 10 months gestation period. They finally took him, and she said that when she went down to look at him, his arms and his legs were all stuck straight out. It looked like he was wearing a fat suit. Well, of course, they didn't have fat suits. She said he looked like he had a snowsuit on. He was so fat. He's not now. He's fine. It's not fat at all. Medical and behavioral screening 1 minute after birth, and then again 5 minutes after birth. Most babies are assessed using the APGAR scale. An infant's score may be affected by the amount of medication that the mother has received. Neurological or cardiorespiratory conditions may interfere with one or more vital signs. The APGAR scale was developed by the pediatrician Virginia Apgar, with APGAR, a quick reference, to determine the state of the neonate. If you have to look at their appearance, of course. If they're nice and pink, everything's fine. You give them 2 points. If they're somewhere between blue and pink, then you give them either 1 point or 0 points if they're totally blue. Pulse, if you're of course you're looking for the baby's pulse, make sure his heart's beating fine. If it's a nice rapid pulse, which it should be, just been traumatized through birth, should be a 2. If it's absent completely, it's a 0. Grimace, what you want the baby to be making faces. That's what the G stands for. If it's crying, which is what you normally want. You want the baby to be crying. That's a 2. If it's just kind of opening its mouth and closing its mouth like a fish, it's a 1. And if it has no facial expression at all, it's a 0. Activity level, usually they're pretty mad. They tend to be really mad. That's why they're yelling and crying. So the activity level should be really active, and if they are, they're moving around and kind of yelling at the doctor, then it's a 2. If they're not making any noise, then usually they give them a 1. If they're limp, completely limp, then it's a 0. Um, Respiration, they should be, if they're crying, then you assume that they're breathing in between screams. Yells, and that's okay. If they're just not making a whole lot of noise, it's a 1. And if it's completely absent, if you can't find any respiration, then you do all kinds of crazy stuff. And they do all this almost instantaneously. And you can see that if you scored a 0 on the APGAR scale, that they would be doing something heroic about that time, trying to get the baby to breathe and cry and the heart beat and whatnot. I mean, it's I've been in delivery rooms where the baby wasn't moving very much, and boy, I'll tell you what, they just really crank in and try to take care of things, and they always did. I was in on a couple stillbirths, but usually when if the baby is supposed to be alive, they make sure it's alive by the time it leaves there's no surprises, none whatsoever. They've been monitoring that kid for as long as he's been in the or he or she has been in the delivery room, so they're taking care of business. 98.6% of neonates achieve an APGAR scale between 7 and 10 within the first 5 minutes of life, and this is my experience as well. Any score below 7 and the neonate is given assistance breathing. That's usually by the respiratory therapist is there. The nurses will suck out the mucus from the baby's mouth and nose. That irritates them to no end. And then if there's not adequate breathing, then the respiratory therapist will come over with a mask and start helping the baby breathe. Any score below 4 and emergency measures will be applied, and I'll tell you what, they kick in right away, almost instantaneously, as I said before. All the delivery rooms I've ever been in, and I've worked in, geez, how many hospitals have I worked in? 10 or 15. I'll tell you what, it's everybody's favorite floor to work on, the nursery and the delivery room. And my own mother said that the reason she wanted to be a nurse was to work in the nursery. Except she called it the damn nursery, because the first thing you do is start changing diapers. It's really kind of interesting. Medical and behavioral screening, the Brazelton Neonatal Behavioral Assessment Scale, the NBAS, assesses neonates' responsiveness to their physical and social environment to identify problems in neurological functioning and to predict future development. The baby is born with elementary survival reflexes that may reflect back to humans as more primitive creatures. And we're going to take a look at the primitive reflexes, I think. There we go. Okay. That's a newborn baby.
All full-term newborn babies are born with some natural reflexes, including sucking, walking, holding, and the startle or morrow reflex. If all these reflexes are present, the parents can be reassured that their baby's development is normal. This will not be the same in premature babies, as they still have some way to go. Following the birth of the baby, the midwife or paediatrician will check for these reflexes. Victoria's newborn Esme is being checked out by her midwife Andrea, and she shows how her legs already know how to move in a walking motion. Consultant neonatologist Ryan Watkins is checking over 3-day-old baby Tamami.
So you can see her legs are flexed and moving normally, and her arms are slightly flexed as well. It's a bit unfair to expect this one to flex too much given the weight of the canyon. And you can see she's a newborn baby, her central tone is low, so she arches over my hand. The baby who's a month or 2 old, you'd expect that to be straighter and trying to lift her head. What I can do then is just check her Moro reflex, and to do this I just drop her backwards into the palm of my hands. It appears a little bit startling, and startled reflex is another word for it. Whee! So you can see her fling her arms out to the side and open her eyes, and then they return to the normal position. If I open her hands up, place my pad of my thumb in the palm of her hand, and you should find she puts
Punch him, kid, punch him.
the same thing happening on her feet. She's flexing her toes now.
Yeah, you tell
Check
her.
it's symmetrical by looking at this side too. She's very alert just now, isn't she?
You saw that bandage on the baby's
These
foot.
reflexes will disappear over time as the baby develops and becomes stronger.
That was from PKU, drawing the PKU. They have to draw it after the first meal. All right, okay. Wait a minute. There we go. Let's get out of here. More moral or startled response when the baby is dropped or hears a loud noise. It extends its arms, legs, and fingers and arches its back and draws its head back. And we saw that in that video. Now we're going to look at the APGAR scale.
My background is Cuban Chinese. I grew up not knowing anybody with sickle cell. I currently just met one person. He's 70.
The APGAR score was invented in 1952 by anesthesiologist Virginia APGAR. It is a scoring system ranging from 0 to 10 and is calculated by evaluating the newborn based on 5 criteria. Each of these criteria can be allocated a score from 0 to 2, and then the sum of these criteria will give you the total APGAR score. In the original article published by Virginia APGAR, the original components of the score were color, heart rate, reflex irritability, muscle tone, and respiratory effort. However, there is an easier way to remember these criteria by remembering the mnemonic APGAR for appearance, pulse, grimace, activity, and respirations. Typically, the APGAR score is calculated at 1 and 5 minutes after birth. If the score is low, you usually repeat the score later. A score of 7 and above is generally normal. Scores less than 7 are low and suggest distress of the newborn that requires some intervention, for example suctioning or stimulation. Although APGAR scores are not used to determine morbidity or mortality, lower scores are typically thought to correlate with more severe outcomes. For example, scores of 3 that are persistent can indicate long-term sequelae such as neurologic damage. However, ultimately, the purpose of the APGAR score is to determine when emergent interventions are necessary. The APGAR score is as follows. You will take a look at the newborn's appearance. If they are blue or pale, you give them 0 points. Blue extremities but a pink body, you'll give them 1 point. And you will award 2 points if the body and extremities of the newborn are pink without any cyanosis. For pulse, if it is absent, you score 0 points. If the pulse is less than 100 beats per minute, you'll score 1 point. And in the ideal situation, the newborn's heart rate should be greater than 100 beats per minute, awarding them 2 points. For grimace, you award 0 points if there is no response to stimulation or the baby is floppy. 1 point is awarded for grimace on suction or aggressive stimulation. And again, ideally, if the baby is crying on stimulation, you award them 2 points. For activity, if the newborn is not moving, you of course award them 0 points. If there's some flexion of the arms and legs, you award them 1 point. If there is active flexion against resistance, you award 2 points. For respirations, if they're absent, you award 0 points. For weak, irregular, or slow respirations, 1 point is awarded. And if the baby is strongly crying, you give them 2 points.
Sorry about that. Okay, there you go, the Apgar scale. Darwinian or grasping reflex, we saw the neonatologist doing this. When the palms of the hands are stroked, the baby will make a fist and is even able to support itself, and that's what the neonatologist was doing. The tonic neck reflex, we didn't see this one. When the baby is laid down, it extends its preferred limb in a fencer pose and flexes its non-preferred limb. Rooting reflex, when the mouth or cheek is stroked, the baby will turn toward the stimulation and begin a sucking response. The walking reflex, we did see this one. When the baby is held under its arms with bare feet touching a flat surface, it will make step-like motions that look like coordinated walking. We didn't see this one either. Swimming, when the baby is put face down in water, it will lift its head and make well-coordinated swimming movements. Remember, it's full of all that water, so it's fairly buoyant, strangely enough. The Babkin reflex, we didn't see this. Yes, we did. We saw this one. When both the baby's palms are stroked at once, the mouth opens, eyes close, neck flexes, and the head tilts forward. Babinski reflex, he was playing with the baby's foot. When the sole of the baby's feet are stroked, the toes fan out, and the foot twists in as if it is trying to grasp a branch. And for some reason, I have a picture of my son. That's him when he was playing indoor soccer in Denver, when he was living in Denver. That's my grandson. I have no idea. I have pictures of my kids. Okay, newborns are able to demonstrate their unhappiness by crying, flailing their arms, and stiffening their bodies. When babies need something, they cry. When they are feeling sociable, they smile or laugh. When their emotions are responded to, they react in a similar manner when the emotion occurs again. Researchers have distinguished 4 distinctive cries that caregivers learn almost immediately. The hunger cry is a rhythmic cry that doesn't have to be associated with hunger. The angry cry is similar to the hungry cry, but with more air force through the vocal cords. The pain cry, sudden onset of loud crying with an episode of breath holding. And of course, this is the one that everybody responds to. We can tell when a baby's in pain. We can tell the difference between hunger, anger, pain, and frustration. Frustration cry, nobody responds to. 2 or 3 drawn-out cries with no breath holding, and you can tell that the baby is not in distress. Babies will sleep 16 to 18 hours out of every 24. Unfortunately, they only sleep in 4-hour sleep cycles, so rarely sleep throughout the night. The baby will not begin sleeping throughout the night until they are 3 or 4 months old. Approximately half of a neonate's sleep is taken up with REM sleep, a sleep pattern that mirrors being awake. REM sleep will decrease as a baby ages. At 4 months, the baby will only be in REM 40% of the time. By 1 year, the baby will be close to adult levels of REM at 25%. While most children will sleep peacefully through the night, many children will have terrifying dreams toward the morning that will wake them up and not allow them to go back to sleep. These are nightmares, and they occur in REM sleep and afflict females more frequently than males. Another sleep affliction is night terrors. Night terrors occur early in the sleep cycle during the deepest sleep. They occur most often to boys, and the child is difficult to wake and will not remember the incident in the morning. Sleepwalking is another problem that children sometimes will have. Sleepwalking occurs during the early night and deep sleep, so the child is hard to wake and will remember nothing in the morning. Bedwetting or enuresis is a common problem with many children after they are potty trained. About 25% of 4-year-olds wet the bed occasionally, more boys than girls. Bedwetting tends to run in families. Sudden infant death syndrome, or SIDS, formerly called crib death, is the third leading cause of death for infants under 1 year of age. However, numbers of deaths have decreased by 70% since the movement to have caregivers put their babies to sleep on their backs. 2,827 babies died of SIDS in 1998. In 2018, there were 1,300 deaths due to SIDS. SIDS is the leading cause of death after the neonatal period and occurs most often between 1 and 4 months of age. Factors in SIDS seems to be exposure to tobacco smoke and sleeping on their stomach. Temperament is a person's characteristic biologically based way of approaching and reacting to people and situations. The New York longitudinal study begun in 1956 by Thomas Chess and Birch led to the pioneering study on temperament. There were 3 categories that they used: easy, difficult, and slow to warm up. 40% of the children in the New York longitudinal study were easy children, generally happy, rhythmic, and biological functioning, and accepting of new experiences. 10% were difficult children, more irritable, harder to please, irregular in biological rhythms, and more intense in expressing emotions. 15% were slow to warm up children, mild but slow to adapt to new people and situations. 35% didn't fit into any one category neatly. The match between the child's temperament and the environmental demands and constraints the child has to deal with is known as goodness of fit. Trouble may occur if the overly active child is expected to sit still for long periods of time. A slow to warm up child is pushed into new situations. A persistent child is constantly taken away from absorbing projects. Temperament can be measured using the parental Rothbard infant behavior questionnaire. Researchers have found temperament largely inborn and probably hereditary. Temperament is fairly stable. Reevaluation at 7 years yielded very similar results as were obtained at birth. Temperament can change during the early months in response to parental attitudes and treatment. And this was a problem that I had with my mother, that my mother and I used to argue all the time. I'm laughing because we had the same temperament. And it irritated her that she couldn't just tell me to do something and I would do it. The shyest children accounted for 15% of the sample. They tended to have blue eyes, thin faces, allergies, constipation, and unusual fears. The boldest children, 10 to 15%, tended to be energetic and spontaneous. Inhibited children that were allowed to be so tended to stay inhibited. Among Canadian inhibited children at 2, their mothers tended to be punitive or overprotective. The children tended to be seen as incompetent, immature, and unlikely to accomplish much. Among the Chinese inhibited children at age 2, their mothers were more accepting and encouraging, even though the children were more inhibited than the Canadian children. In China, inhibited and shy children are socially approved, but not in Canada. Patterns of growth. Children grow faster during the first 3 years, especially during the first few months, than they ever will again. This rapid growth rate tapers off during the second and third years. By 5 months, the average baby boy has doubled his birth weight, and he will triple it by his first year, by the end of his first year. By his second year birthday, a boy will only gain about 5 pounds add about 5 pounds to his weight. A boy's height will typically increase by 10 inches in the first year to 30 inches. They will gain 5 inches in height the second year to 3 feet. The baby begins teething at 3 to 4 months, but they typically don't emerge until the 5th or 9th month. By 1, they will have from 6 to 8 teeth. By 2.5, they will have a mouthful of 20. And there's a picture of my grandson when he was about a little bit over a year, walking around with his uncle's Coke can, which doesn't have any Coke in it. All the Coke's over here. Whoops, I don't have an arrow. Just a second. All right. Here's the Coke right here. He's got nothing in that can. He's just walking around with it. In the womb and after they are born, children develop from head to tail, cephalocaudally, and from the inside out, proximo-distally. The head and the brain are the largest thing about the developing fetus and a newborn. At 2 months gestation, it takes up 1/2 the body length. At birth, it takes up 1/4 of the body length. As adults, our heads are about 1/8 of our body length. And as you can see, this is about half. This is at 2 months gestation. It's about 1/3 at 5 months. There's the newborn at 1/4, and there's the adult at 1/8. And that's a female. This is what the males look like. It's exactly the same thing. There's the birth, it's 1/4, and as an adult, it's about 1/8 of your height. Influences on growth. Genes interact with environments such, for example, nutrition and living conditions impact general health and well-being. Well-fed, well-cared-for children grow taller and heavier than less well-nourished and nurtured children. Better medical care, immunization, and antibiotics have led to better health. Bottle feeding babies did not become possible until the 17th century in Europe. Before that time, if a mother didn't want to breastfeed her own baby because of inconvenience or sagging breasts, she would find another woman and have her breastfeed for her. This woman was known as a wet nurse. In the 19th century, an increase in infant deaths was blamed on wet nurses and bottle feeding. In the 1920s, bottle feeding became popular and didn't go out of vogue until the 1970s. Breast milk is almost always the best food for newborns and is recommended for at least the first 12 months. Parents can avoid obesity and cardiac problems in themselves and in their children by adopting a more active lifestyle for the entire family and to breastfeed their babies. At birth, the brain weighs about 25% of its eventual adult weight of 3.5 pounds. By age 3, the brain will be 90% of its total size. By age 6, it is almost at its adult size. The brain's maturation takes much longer than was previously thought. Brain growth spurts coincide with changes in cognitive behavior. The learning of language, environmental stimulation, specialization of the hemispheres is called lateralization. The left hemisphere is for language, and the right is for visual spatial knowledge. The brain represents 70% of the weight of the nervous system. Occipital lobe is for the visual information. This is the occipital lobe in the back, right above your cerebellum. The temporal lobe is hearing and learning, and it's right behind your ear. Parietal lobe is touch and spatial information. That's right on top of your head. And the frontal lobe is for higher level thinking, such as speech and reasoning. It's right in the front. So if somebody keeps popping you in the head, then they are slamming you in the frontal lobe. Pinky and the Brain. You guys don't even know who Pinky and the Brain are. Molding the brain, the role of experience, smiling, babbling, crawling, walking, and talking are possible due to rapid development of the brain, particularly the cerebral cortex. Plasticity is modifiability of the brain. Throughout early life, the brain is creating more and more complex neuronal pathways because it is so plastic. Even before birth, the brain is integrating neuronal coordination of muscle groups, a process known as integration. At the same time, select neurons are being developed to have a specialized structure and function, a process known as differentiation. When neuronal cell functions are no longer needed or no longer used, cell death occurs and the body prunes the excess brain cells. And if it didn't, this is necessary, and if it didn't prune these excess brain cells, what would happen to the old brain cells? They would potentially become like Alzheimer's disease. They would clog up the brain. So it needs to clean all this stuff out. Early experience can have lasting effects on emotional development and capacity of the central nervous system to learn and store information. Sometimes corrective experience can make up for past deprivation. Myelin, a fatty insulating substance, begins about halfway through the gestation in some parts of the brain and continues into adulthood in others. This accounts for improving abilities at various times during adulthood. Milestones of motor development: babies first learn simple skills and then combine them into increasingly complex systems of action. Humans begin to walk later than other species, possibly because babies' heavy heads and short legs make balance difficult. One test that has been developed to chart motor development is the Denver Developmental Screening Test that charts a baby's progress and compares it to other children of similar age and gender. How motor development occurs, maturation in context. According to Thalen, normal babies develop the same skills in the same order because they are built approximately the same way and have similar physical challenges and needs. Not until babies can get around by themselves do they learn from experience or from a caregiver's warnings that a steep drop-off can be dangerous. If there are chances to explore their surroundings, motor development is more likely to be normal. Some cultures actively encourage early development of motor skills. Giselle concluded that children perform certain activities when they are ready, and training gives no advantage at all. Findings do not indicate whether changes in the brain or in muscle strength, or both, are involved in motor development, but they do suggest that interaction of biology and environment. Touch seems to be the first sense to develop. Pain experienced during the neonatal period may sensitize an infant to later pain, perhaps by affecting the neural pathways that process painful stimuli. A preference for pleasant odors seems to be learned in utero and during the first few days after birth. Preference for the fragrance of the mother's breast may be a survival mechanism. Newborns' rejection of bitter tastes is probably another survival mechanism, since many bitter substances are toxic. Hearing is functional before birth. Auditory discrimination develops rapidly after birth. Hearing is a key to language development, so hearing impairments should be identified as early as possible. Vision is the least developed sense at birth. Vision becomes more acute during the first year, reaching the 20/20 level by about the 6th month. Binocular vision is where the individual uses both eyes to focus. This leads to the perception of depth and distance developing at 4 to 5 months. And that is the end of chapter 4. Where is it? 3? 3, I guess. Okay. Oops, sorry. So I'll talk to you guys next week.